Thank you very much, my dear student. This is your clinical class. This is your clinical class. So my question is, what is the aim of this class? The aim of this class is history taking, patient examination, then history presentation. Remember this. History presentation or salient picture or case summary. Remember this. First of all, you have to introduce. First of all, you have to introduce with your patient. Remember this. You have to greetings. You have to greetings to the patient, and history should be taken from patient himself or from the attendants. Remember this one. The history should be taken from patient or from the attendants. Remember this one. First of all, you have to greetings to the patient. If you are Muslim, then you say Assalamu alaikum. If you are Hindu, then you say Namaste. If you are Christian, then you say good morning or good evening, like this. After this, then you have to handshake. You have to handshake with your patient like this. Like this, you have to handshake with your patient. Then the patient will be relaxed to you. He give the proper history to you. Remember this. First of all, you ask the patient that why you came here. What is the problem of you? This is your chief complaint. After chief complaint, then you elaborate the chief complaint. Elaborate the chief complaint and some systemic inquiry for differential diagnosis. Remember this. This is called the history of present illness. After present illness, history of present illness, then you ask history of first illness. When she or he is suffering from any other disease before any times. After history of the first illness, in pediatrics, then and then you ask about the birth history. That is antenatal, natal, postnatal history. Remember this one. After birth history, then you ask them your feeding history, whether prelactal feeding given or not, breastfeeding is given or not, colostrum given or not, breastfeeding up to 6 months given or not, like this, and complementary feeding given or not. This is the feeding history. After feeding history, then you ask them the development history. Development history start from social smile. It start from 4 weeks. 4 weeks, social smile. Then neck control. That neck control comes in at the 3 months. After neck control, then crawling. When baby is crawling, it is suppose 3 to 4 months. 4 months to 5 months, this baby is crawling. After crawling, then ask about the when she or he is sitting. When baby is sitting, because normally baby is sitting at 6 months of age. After sitting, then you are asking about the standing. When the baby is standing, it is normally 9 to 10 months, like this. Then after standing, then walking. Baby generally walking at the age of 15 months. Remember this. At the 15 month, baby is walking. Now the space. It's one word is space. One word can be spaced by 1 year. 2 words he can tell at the age of 2 years. 3 words he is explained at the age of 3 years. Remember this. After development history, then you get immunization history, then socio-economic history, then family history, then treatment history. After this, then you go for general examination. You should remember there is 24 points. In general examination, there is a 24 points. 24 points. You should remember this one. After general examination, then in pediatrics, you should measure the anthropometric measurement. That is body weight, height, and anteroposterior occipital circumference, and making them in a Z score. This is called anthropometric examination. After anthropometric examination, then start your systemic examination. We start with suppose elementary system, then respiratory system, then cardiovascular system, then nervous system, then musculoskeletal system, then urinary system. After all system examination, then you are making the case summary or salient picture. Remember this salient picture. After salient picture, then you ask your provisional diagnosis. After provisional diagnosis, then you make points in favor and points in against. Remember this one. After provisional diagnosis, then you go for differential diagnosis. Differential like 2 or 3 you will make. After differential diagnosis, then you go for investigation. After investigation, then you conformity diagnosis. After conformity diagnosis, then given the treatment. treatment according to cause. According to the cause of the patient, there are several types of treatment, some supportive treatment and specific treatment. Remember this one. After this treatment, then follow-up of the patient. Then follow-up of the patient. After follow-up, then counseling. Parents counseling is the main theme of your parents counseling, main theme of the examination. Remember this one. After counseling, up to this you should know. Remember this. These are the steps of the history writing. Remember what is communication. What is the communication skillness? This is the one question come in paper 1, medicine paper. What do we mean by communication? What is communication skillness? And patient and doctor's relationship also come this question at this time in the paper 1, medicine paper 1. This question is coming. What is the communication? What do we mean by communication skillness? And what is the relationship between the doctors and patient? You should remember this one. The answer is like this. What today, just like what I tell you just now. This is the answer of the communication skillness and doctor and patient relationship. Remember this. Thank you very much. Thank you very much for patient hearing.